I just realized that I've been wearing this shirt backwards every time I've worn it until right now. Hey, welcome back to my channel. So today we'll be concluding my Dancers with Disabilities series. Well, concluding is a bit of a strong word. Definitely come back to it in the future. Please don't forget to check out parts 1 and parts 2 of the Dancers with Disabilities series that I've put together. I hope you enjoy the video today.
My name is Serena. I am 25 and I have been dancing for 23 years.
Well, my name is Victoria Calix. I am 30 years old, and I've been dancing on and off since I was very little. Yeah, pretty much on and off. I didn't really take it seriously until a couple years before we met. 4 years ago now we met.
So I have Asperger's syndrome. It is a low mild form of autism.
I have rheumatoid arthritis, and along with that, I also have auditory processing disorder.
So a lot of coming to learning dance is having eye contact movement. It's mostly when I'm dancing on stage in front of people. I have a lot of social interaction and difficulties keeping my eyesight forward. A lot of times when I'm dancing, it helps with a lot of self-confidence. I'm always looking at the ground. It's difficult interacting with other dancers, like working as a team. That was really difficult growing up.
So with the rheumatoid arthritis, it affects my whole body. With a lot of patients, it'll affect either just the hands or just the knees. For me, it's everywhere, and I have to be careful it doesn't spread to the organs. So it's a pretty severe sign. So I take as many precautions as I can to slow down the process and keep myself from becoming a cripple that much sooner.
And what was the other one that you had mentioned?
Auditory processing disorder. So I'm a very slow learner. Sometimes it takes me a while or a few times to understand something. Like something will distract me in the back of my head while someone's talking to me, or I try and say something and I can't say what I'm really thinking. Like I can't really get it out. And especially when it comes to dance, I like to record a lot of my classes and choreography because I can't just get it after a few tries just by looking at it without recording it, going back home and really, really studying to polish it.
Mostly I kind of had to just tell myself to look at people and that it's okay to stare people in the face, and it's kind of just a lot of self motivation and other people dancing with me. It kind of bumps up my energy to where I don't even notice that I'm not looking at the floor. So a lot of it is self motivating myself and other people motivating me.
The auditory processing, it takes me a lot longer than the norm to get something. It will take me like 100 times to look over something, go back home, and times after that. And when I finally get it, like I got it really good, and I got it super polished, and I look amazing. But if you were to teach me the choreo like 3 times, I look like I have a stick up my ass or something like that. Like I can't get it. It's not stuck in my head. In regards to the rheumatoid, certain movements are very painful. Like plies, like deep, grand plies, jetés, different jump routines. Getting up from the ground up. It can be very painful, but I try to push through as much as I can.
So I think what you can take positively from it is that you become more intuitive of people around you. And especially with dancing, if you're dancing in a group, not really if you're dancing with yourself, but if you're dancing with a group, you have to be very intuitive with other people around you and their movements, and becoming aware of yourself, and even just focusing, not looking at the floor, makes it a lot better. And you connect with people on a deeper level, and you can, like, if you were learning something, you can connect with the music and the dancers more.
Yeah, definitely gave me made me view life and accept, be grateful for what I have, and be grateful for the life that I have, even though it these struggles. But because of this, I'm taking better care of my body. Um, I want to say, taking better care of it than most, because it's such a struggle. But in the long run, when it comes to dance and I exercise, it makes my body feel so much better, that much more limber, less pain. The more doctors have told me, the more you move, the less pain you'll be in. Keep moving. I don't care how much pain you're in. You could be crying and screaming bloody murder, but as long as you keep moving, you're definitely going to suffer less and cause less damage to your joints and to your body.
I would say to just, be comfortable with who you are, that it judges you based off of what you have, and that, eventually it's something that you can adapt and move on with. And I think it's just easy to have other people be understanding of when somebody does have a disability, that, hey, it might be a little slow for me. I will eventually get it.
Advice: just keep moving. Um, no matter how much pain you're in, I highly suggest, don't stop taking your medication. Don't think it's gonna get better. Not. There's no cure for it. Just persevere.
I think so. When I first found out about it, they're like, oh, she's gonna, when people think autism, they think the typical, like, autistic kid that doesn't communicate or doesn't talk. They have this definition of autism in their mind that, we all act a certain way, but there's so many different forms. Some people are very high, some people are very low. In my case, you can barely tell with me, but it's just my form. So if I tell somebody before I dance, they assume, oh, she's not going to do well. She's going to look down and not look at the audience. And then they see me dance and it's the exact opposite. So it's nice proving people wrong.
A lot of the time negatively, because when you look at me, a lot of people, I'm sure you're like, oh, doesn't look like she has anything. You look fine. You look healthy. I get that so much, and a lot of the time people think I'm faking it, and it can be very frustrating because, when I try and explain my struggles, they kind of give me that look like, yeah, sure, kind of thing. Um, yeah, I try not to let those get to me. But it's very hard at times when, you're working so hard to try and seem normal to others, and try and do things, that other people normal people do. It's frustrating, especially the ones who, have disbelief. They really don't know. They're ignorant, or they don't want to believe that I have this condition, and it's very frustrating. It can cost me, certain parts, when it comes to stage performances, like, oh, she complains too much, or I don't believe her, so how can I trust her to do this part, because she's most likely lying that she has this disability, and I suffered through that since my diagnosis. um but yeah, it's been a tough road, but I try my best not to let it get to me, because I do have those people who really, they know what I'm going through.
Thank you guys so much. Thank you to everyone that participated in this series. I really do appreciate the time that I had to speak to all 6 of the people that came forward to discuss the issues that they face while being a dancer. I do hope that this series has touched you, whether you're a dancer or not, and just to let you know that there are people out there who are like you, who are experiencing similar things to you, so you are not alone. Thank you for watching them. I'm very excited to continue on this journey. I will be back very soon with a new video on a new topic, and that first video includes yours truly. And one last thing, please don't forget to give me a thumbs up and comment on my video, and subscribe to my channel if you are interested in seeing this content. Please subscribe so I can it just lets me know that you actually are interested, and I can continue to put out videos that do revolve around dance. And I will see you guys when I see you.